You're listening to On Shifting Ground. I'm Ray Suarez. As we reflect on the first days of the COVID-19 pandemic, it's easy to forget just how little we knew then and how scary it all was.
Several breaking developments tonight in the coronavirus outbreak.
Tonight, President Trump addressing the American people just a short time ago as the toll of the coronavirus widens.
Tonight, I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world.
Coronavirus officially reaches pandemic proportions. What it means and what it calls for.
This is a call to action and a call not to give up.
But the longer the world carried the burden of the pandemic, the clearer it became we were dealing with more than a contagious disease. Long stretches of lockdown meant millions were stuck at home, missing work or school, while frontline workers put their health and lives on the line to keep their jobs. And 3 years later, the world still hasn't recovered. How did a microscopic virus transform the economic lives of billions of people? And how did it erode social capital, endangering our institutions and social norms in the process? To help answer these questions, we turn to global development experts from the World Bank. Norbert Shadi is Chief Economist for Human Development, and Mamta Murthy, Vice President on that same team. They recently published a report about how COVID-19 has eroded human capital, particularly in the developing world, and what we can do about it now. Welcome to the program.
Thank you, Ray.
Thank you, Ray. It's great to be here.
It's an enormous topic. It almost feels like where to begin. What are some of the less talked about aspects of what we confronted first as a communicable disease, a contagion, a public health challenge? What are the things that we're now learning about the other effects of this disease? Norbert?
Thanks, Ray. We recently put out a report here at the World Bank that I co-authored, which addresses exactly what you're asking. The pandemic had a devastating effect on what economists refer to as human capital. And human capital, while it sounds like a complicated concept, really isn't very complicated. It's the skills that people have that allow them to earn income and be productive as adults. And we show in the report quite clearly that at different stages of the life cycle, early childhood, among school-age children, then amongst young people who are trying to make the transition into jobs, there were very serious setbacks, really a collapse of human capital for these people in developing countries. And we argue that the consequences of this are likely to be long-lasting unless we are able to revert some of these losses. Long-lasting in terms of productivity and long-lasting also in terms of inequality, because we show in the report, using data from a large number of countries, that these effects were perhaps unsurprisingly largest among poor households. So the poor suffered the most, and unless we can figure out how to revert this, they are likely to keep on suffering from this. So just to sum up, we all know about the health costs of the pandemic, the number of deaths. We know that there was a big contraction in the economies of both rich and poor countries, especially in 2020 and 2021. But little attention, or much less attention than is necessary, has been paid to these other dimensions of well-being, which really allow societies to function well in the future.
It's interesting that you say that, because before the pandemic, a lot of places in the world were just squeaking by with a lot of effort, with a lot of creativity, managing to give kids the bare minimum. What happened, Mamta Murthy, once the alarm was sounded? What happened that caused this drop in human capital among the young, in communities across Africa, Asia, Latin America, Europe?
Well, one of the first things that happened were lockdowns. In order to contain the spread of the virus, people were asked to stay at home. And schools were shut down. Preschool centers were shut down. And some of the consequences that we are now observing on human capital are a result of these shutdowns. Let's take the youngest children, right? The ones that would have gone to preschool. The fact is that preschools were closed in many countries for long stretches of time. Preschools provide the early cognitive stimulation that young kids need in order to be ready for school. They also often provide nutrition and supplemental food, which helps young minds and young bodies develop. These kids were often at home with parents who were stressed. Unfortunately, some of these kids even lost their parents and lost their primary caregivers. Many parents were stressed because they were at home and not able to earn an income. We know that unfortunately, there was also an increase in gender-based violence. Many women primarily had to face the consequences of this. So as a result of being at home as a preschool child with parents who are stressed, not having the stimulation of going to school, not having the nutritional supplementation that comes from going to school, means that now that economies are recovering and kids are going to school. Remember, they would have been in preschool in 2020. Now they are probably going to school. They're not quite at the level that they need to be at in order to benefit from instruction in school. Where we have data on this, and we don't have it everywhere, we are able to observe that kids are not ready. They're about 30% below the level they need to be at in terms of reading comprehension and in terms of beginning to do basic math. And they're also not socially, emotionally ready to go to kindergarten and sit in a classroom and listen to what their teacher has to say. So that's the kind of consequence that we are observing on very young children. We're observing similar things in school and for kids who are in school and had to stay at home. And I can talk about that some more, Ray, if you want me to.
Well, let's concentrate first on the very young, because if you look at a timeline of the human race, preschool's a pretty recent phenomenon, and even universal primary education is a fairly recent phenomenon. Why is this considered such a devastating loss rather than something that with time can be compensated for, that we can catch up, that we might hit some of these learning and developmental milestones just a little later rather than not at all?
You're absolutely right to say that preschool is not universal, and it's not universal in many developing countries. That being said, we know a lot more now about what happens in those early years. And we know that having a good start in those early years, even before you get to school, has a huge impact on how well you learn at school, and then later on, do you graduate from school, do you get a job, and so forth. In economic speak, we say that human capital is cumulative, and you build on it from a very early stage. So if you miss out at that very early stage, it's very hard to recover from it unless, there are remedial measures that are put in place. Let me make it very evocative. We know there are kids who have missed immunizations. Well, if you don't make up your immunizations, you're going to fall sick and you're not going to be at the level of development that you need to be in order to be able to learn at school. Or if you have suffered from nutritional deprivation, your mind as a child is not going to be firing the way it should. You're not going to absorb all the information that you receive. If you have parents at home who are stressed and they're not reading to you or they're not interacting with you as a child in a way that sort of stimulates you and helps you learn, well, you're not going to arrive in school, in kindergarten, ready to learn. So that's why this setback at this very early stage is so important. And if it is not remedied, can have consequences over the lifetime of children. In fact, that's why we're saying in the report that Norbert has led, we're saying immunizations need to be made up. Nutritional supplementation for these kids who've been out of preschool needs to be thought about. And then school systems just need to be prepared to be receiving children who are quite different developmentally than what they would have been had they not gone through this stressful period of the pandemic, and their parents had not gone through this stressful period of the pandemic.
That variable of stress, Norbert Shadi, we often use as kind of a coin of the realm how much attention a kid gets from parents, how many words are spoken to a child during the first years of life. At first blush, you might think, well, you spent a lot more time with your mother and father than you would have otherwise. maybe that's not such a bad thing, but if we add the stress of the pandemic, is that where the difference lies? That it wasn't necessarily such a bad thing that you were with your parents a lot more, but the circumstances created a less than ideal environment.
Well, I think that's right, Ray. We have evidence from a variety of settings of sharp increases in depression amongst parents, in particular amongst mothers. And we know from a long literature, as Mamta was referring to, we know from a long literature that higher levels of anxiety and stress amongst parents are very bad for children's development. Parents simply cannot cope the way they would normally cope with their children. And so this really had very important effects on child development. And I want to stress one thing, Ray. We now know a lot from a large literature that has looked at this, that children don't rebound on their own. Young children, that concerted efforts need to be made for children to rebound. And moreover, we know that in particular, amongst poor households, children are less likely to rebound. And so the notion that somehow, well, they're young children, they've got a lot of time, they can make things up, that really doesn't hold very much in setting. And so we argue that there really needs to be much more attention from policymakers than there has been to these ages. And I want to say one more thing about that, which is many of these children who were very badly hit at young ages now have made their way, as Mamta was saying, into preschool or into formal schooling. And in some ways, perhaps that is a little bit of a silver lining in that at least we know where they are and we have evidence of some policies that could actually benefit these children in schools. It's a lot harder to work when all of these children are, if you want, at home, and we don't really have policies and programs that are adequate to reach them, and if you want, help with the stimulation that they should receive at home.
I guess a lot of this burden probably falls on teachers. After a year out of the classroom, kids have had erosion in their cumulative mastery of numbers and literacy, early literacy. They're probably less able to sit and stay on task, less able to cooperate in the classroom. Have we really paid enough attention to teachers and the heavy lift they have coming out of the pandemic? Mamta Murthy?
I think the attention to what children need now that they are entering school for the first time or coming back to school after a long gap, it's not receiving as much attention as it should. And by implication, the way teachers need to be supported to teach children is not receiving as much attention as it should. I'm not saying it's not being addressed anywhere. I'm saying it needs to be addressed everywhere. That's one of the reasons why we wrote the book, is to bring attention to this issue. Now, teachers themselves have had a difficult time, and now they are, because of the lockdown, the fact that they've had to teach remotely. You know, in many developing countries, I would say the majority of children did not have access to the internet at home when schools were closed. And we know that on average, children in developing countries were out of school for one full academic year. That's just the average. So in some cases, we have kids who've been out of school for 2 years, right? So we've had a situation where teachers were asked to provide instruction to these children remotely. In most developing countries, this meant instruction via television, instruction via printed materials that may be sent to the kids' home, and some lessons on the internet. But this was provided to a very small proportion of children because access to the internet is limited. So now teachers are confronted with these kids who've come back. They're at very different levels of understanding of the curriculum. So to make it very concrete, a kid who was in second grade when schools shut down might now be in third or fourth grade and may have learned at a very different level from his or her peers. So the teacher is in a classroom confronted with this grade where kids have very different levels of understanding of the curriculum. And this teacher is expected to teach these kids at what is probably on average a higher level than what they're expecting. And moreover, there are lots of differences amongst them, right? Some kid in the class may have learned a lot while being at home, and another kid may have learned nothing or may even have forgotten what they've learned. And these teachers then have to deal with this classroom with very different levels of understanding of the curriculum. And that's the part that education systems and school systems need to think about. How do we help these teachers deal with classrooms that are on average not prepared, classes that are on average not prepared for the material, and moreover at very different levels of understanding?
I've been interviewing American teachers for decades, and widely they say that one of the most difficult parts of the job is getting kids back on level and back on task and getting the class moving again after the unusually long summer holidays that we have here in the United States. Kids basically out of school from June to September. But we're talking about a year and a half, 2 years. I can't even imagine what it's like to get everybody back on task. Has there been, from UNESCO, from the World Bank, from the IMF, from international bodies that develop curriculum, has there been some sort of fire brigade that's able to talk to the teachers and say, look, we know the situation that you're in. Here's some best practices. Here's how we should address this. Because the world's children have missed billions of days of school.
Let me start by saying, Ray, that the numbers really are beyond shocking. 1 billion, that's not million, 1 billion children in developing countries missed a year or more of schooling. This is a problem. This is a situation which we've never confronted before. And so clearly there's need for a lot of experimentation and a lot of sort of trial and error on how best to recover these learning losses. But we do know some things that are quite likely to work. And let me talk about a few. I went to school as a middle school student and a high school student. I went to school in Peru. And we learned a lot about Peruvian history, heroes, and the geography of Peru and so on. If I hadn't learned that at that age, it probably wouldn't have made that much of a difference. But if I had not learned the math and the language that I learned at that time, it would have made a very big difference, because it would have made it very difficult for me to learn thereafter. So one thing which we've argued countries should do is curriculum simplification. Really focus on the basics. Focus on the stuff that is really critical for children to learn: basic language, basic math, social-emotional skills, all of these things that really are the building blocks for them in the future. We've also talked, some countries have been able to put into place remedial education programs. So test kids when they come back to school. There's a lot of talk about, the virtues or not of testing. But in this case, it's a really different situation, because as Mamta was saying, different kids arrive at school at very different places. And it's really critical for a teacher and for a school system to know this kid is really far behind and we need to do something to get her to catch up. And this is another one of the interventions that we've talked about.
You're listening to On Shifting Ground, produced by World Affairs in San Francisco. If you missed any part of this episode or want to catch up on other international stories, download our podcast on Apple, Spotify, or wherever you get your podcasts. Norbert Shadi, we've been talking a lot about early childhood and early childhood development. I want to talk a little bit about older school kids. They're going to be entering the workforce a lot sooner, and we have a lot less time to make up for the deficits accumulated during the pandemic. Is there going to be impact on national economies? Are countries going to be less wealthy because 15, 16, and 17-year-olds will soon be entering the workforce after missing a big component of their educations?
Absolutely. And we know that human capital is one of the main drivers of economic growth. And for individuals, for poor people in particular, human capital is really the only thing they have. It's the only, if you want, wealth that they have. And if you take that away from them, you really are condemning them to a life where it's much less likely that they'll be able to make basic ends meet in the future. Now, let me talk briefly about young people, because I think that is also an important issue. Normally, between ages 16, 17, a little bit later, depending on the country, young people make the transition from schooling into the labor force. This is a critical transition. And what we find is that as a result of the economic contraction, the lockdowns, and so on, many millions of young people were unable to make that transition successfully. So we have young people who under normal circumstances would have found a job, who cannot find a job, young people who did find a job, but a much worse paying job, or a job with much less security. And we also know from the literature, this results in what's called, economists call scarring. What that basically means is that it's hard to recover from a bad start. Before, we've been talking about a bad start amongst young children. Now we're talking about a bad employment start amongst young people. This is even the case in the US. Individuals who graduate during a recession in the US earn lower wages than those who graduate in more favorable economic times for at least a decade. So this really stays with people. Unless we figure out how to remediate some of these losses, unless we figure out how to get the labor market to start working in some of these poorer countries, we really are facing a very dire situation, not just now, but for years to come. 90% of the prime age workforce in 2050, 90% are people who are below 25 years of age now, which are precisely the people who have suffered from the pandemic. So think about now, 90% of your workforce in 2050, unless we figure out what to do about it, is going to be substantially less productive than they would have been in the absence of the pandemic. That's really quite shocking.
And they're going to be disproportionately in Africa. Tremendous share of the prime working year adults of the world in 2050 are going to be in Africa. But so far, the trajectory of this conversation, I got to tell you, has been pretty depressing. It doesn't sound like there's much possibility for recovery, that over time we can't replace some of these deficits, make up for some of the lost learning, catch up with where not only a young student, but a young worker might have been otherwise. You got to give my listeners a little hope here, Mamta and Norbert, that there are practices, that there are things that we can put in place, that there are responses that have a shot at giving these young people a shot.
There are, and let me say that categorically. This is the reason why we wrote the report. We wrote it for two reasons. One, to draw attention to the shock. Because if we don't draw attention to it, it gets forgotten. And something that's forgotten, you don't act upon it. So we really wanted to make sure that people were aware of this hidden crisis that has occurred to human capital because of the pandemic. The second reason why we wrote the report is because we wanted to draw attention to the things that can be done. Some of them have financial costs, but governments need to think about prioritizing these investments if they're thinking long term. Some of these things require political will, and that's why also we wrote the book, because we wanted to say, look, there's things you can do. You just have to make this a priority for the government politically. And some of these things have implementation challenges, and we also wanted to draw attention to that. So in a nutshell, for the kids who are still not in school, we talk about recovering immunizations. We talk about cash support programs, which can be put in place to support these kids. For school-age kids, we talk about testing so that school systems and teachers are aware of what level kids are at. We talk about simplifying curriculum. We talk about extending the instructional time. We talk about teaching so that there's time to make up for the stuff that's been missed. We talk about teaching at the right level. And then for young people who are entering the labor market, we talk about a range of measures that can be taken to make sure that they get a good start now that economies are recovering. And that can include sort of measures that are directed at young people, active labor market programs, training, preferential employment of young people, and so on. Finally, let me say that while we've talked a lot about school systems and governments, there's also a huge role for parents and communities. And we really don't want to underemphasize that. The best example I can give is from India, my home state of Tamil Nadu, where the government of Tamil Nadu decided to measure how much kids knew in December 2021 when schools reopened. And then they launched a massive campaign in which they involved people to read to kids in the evening after school and help them do a little bit of math after school. And this was community mobilization. These weren't the regular school teachers. These were kids who had finished high school and were looking for something to do. These were college graduates who didn't have anything to do. So they volunteered to be a part of this community mobilization and teach the kids in their communities in the evenings. And because the kids were measured, their learning levels were measured in December 2021, 3 or 4 months later, you could go back and measure how much they had learned as a result of both returning to school and these extra instructional hours. And these kids are really making up and recovering to get to levels that they need to be at. So there are good examples out there of concerted action, making this recovery of human capital a priority, mobilizing both government policy and communities, and getting things back on track. So I hope that we can come back to you at a later point and give you many more examples of this kind of thing that's going on.
Norbert, can you think of any examples, especially since we're talking about, for most of this conversation, some of the countries that have the least resources to put toward making up for educational deficits? Their cost per child was already pretty low on a world scale, but maybe this doesn't necessarily always have to do with money. There can be creative approaches and better use of people's time that helps people catch up. Any models that we can look to? Any examples of countries that have played a bad hand well?
Well, I want to go back to one of the Mamta alluded to before, which is what's called Teach at the Right Level, often abbreviated as TARL. And the reason why this has been successful is what you do basically is kids are in their regular classrooms during much of the day, but for part of the day, they are not in the classrooms that correspond to their age necessarily, but those that correspond to the level of learning that they have. So you might have a 12-year-old for that part of the day in the same classroom as a 9-year-old. In another classroom, you might have two 12-year-olds together. And that's because this one 12-year-old really is more at the level of a 9-year-old, and makes sense for that 12-year-old to be learning the basic concepts that allow him or her then gradually to catch up. And there's been a lot of evaluations of this approach, not only in India, it started in India, but in other countries as well, which show that this really can help kids make up. I also want to say one last thing, which isn't exactly related to that, Ray, but I think it's an important point. Around the corner, there are going to be either more pandemics or other large-scale economic shocks or climate shocks or so on. And there are things that countries can do now. And we have a whole chapter in the report that goes into this. Things that countries can do now to better prepare for those shocks in the future. And this is not something that only rich countries can do. I want to give you one example for that, coming from Africa, since you referred to Africa before. Some countries in West Africa were very badly hit by the Ebola epidemic in 2014. And those countries that were badly hit by the Ebola epidemic in 2014 did much better in response to the pandemic than other countries in Africa, including countries of higher income levels. And why is that? Because they figured out, here are the things that we try to do. These here worked, these here did not work. And so they're better prepared. And so we urge in the report that in addition, there's two parts to this. One part is, how do you make up these losses for these kids and young people that really are very serious? And we think there are things, we kind of have evidence that there are things you can do, as we were referring to, but we're also saying, be realistic. These things are unfortunately going to keep on happening. Prepare better. And that's really, really important. We have other examples of that as well. But I think that's also a very important message. Prepare. Prepare now, because it's really hard to respond if you haven't prepared before.
COVID is still out there. People are still getting sick. People are still dying. But has the storm died down to the point where national systems can start to address the action items in your report? Or are we still so bound to this crisis that it's like, I can't pivot to do this other thing yet. I've still got clinics full of people who are sick. I've still got people who are dying. Have we gotten to the point in some of these terribly affected communities where we can think about 2026 and 2027 and 2028 and what they're going to be like? Or are we still in the final chapters of COVID-19?
So let's talk about Africa. What one would say about Africa is that COVID, they don't have hospitals full of patients with COVID. If anything, they have actually pivoted to addressing all the issues that they had to address even prior to COVID. It's about maternal mortality. It's about child health. It's about malaria. It's about cholera. It's about all these other issues that the health system has to deal with. There are some countries in Africa where the school closures were very long, like Uganda. In most countries, the school closures were not that long. So we're talking about 3 to 6 months, in part because the pandemic, COVID-19, despite what we were saying in 2020, March 2020, when we thought that COVID would just race through poorer countries because they had weaker health systems, contrary to expectations, the impact of COVID was not as severe as was anticipated. So schools, in fact, except for some exceptions, schools didn't close for more than 3 to 6 months. So these countries are really dealing with very low levels of learning, something that they have had to deal with even before the pandemic. And dealing with those low levels of learning are really about having enough classrooms, having enough teachers who are trained, focusing on foundational skills, right? Basic literacy, basic numeracy, and making sure that kids are getting the socio-emotional skills as well to advance through the school system and address the labor market. So if I just take an Africa lens, I would say that COVID is not the issue that's dominating the landscape. It's really around getting economic growth at higher levels, dealing with the fact that many countries are facing the issue of very high rates of food price increase, food inflation. And then, of course, with the rise in interest rates, they are facing issues of needing to service their external debt, particularly commercial debt. So I would say those things are dominating. And the purpose of our report is to really say, look, don't forget that you have these long-standing issues with learning, which are going to cripple your longer-term rates of growth.
Norbert Shadi, given what Mamta Murthy just said, it sounds like the worst possible thing that could have happened coming out of COVID is the ripple effect of the invasion of Ukraine, that this was just what the world didn't need. Is that fair?
Well, that's right. I think it had lots of deleterious effects globally, but I think two that are related to this are, one, it was like a crisis that came on top of another crisis. And so the cumulative effect of this can be really, really devastating. It's very heterogeneous across countries. Some countries have suffered much more than others, for example, because their imports and exports can be very different. Some are oil producers, some are not, and so on. But absolutely. But the second effect that it has had, which I think is really as important, is the fact that it's taken, in many cases, amongst many politicians in developing countries, it's taken sort of COVID off the table. Oh, we have a new crisis. We have to deal with this crisis now. And that the costs of that, I'm not saying there isn't a new crisis. There is a new crisis. But what we're saying is really, some of these other problems that you are facing, some of which are a result of the pandemic, some of which were already there before and already been made worse by the pandemic, these are things you have to address, even if you have another crisis on hand. And that is because, as Mamta was saying, and she's absolutely right about this, it's going to hamper all your efforts in the future to have higher growth rates, to be able to reduce poverty and give people a decent shot at a satisfying life, at a productive life. And it's easy for politicians inherently have short time horizons. It's easy for politicians to sort of forget that, or if you want, wish that away, but it is there.
Well, as Mamta Murthy suggests, we'll have to check with you both down the road and see how the world is pulling out of these problems. Mamta Murthy, Vice President of Human Development at the World Bank, thanks for joining us on Shifting Ground.
Thank you so much, Ray. It was a pleasure.
And Norbert Shadi is Chief Economist for Human Development at the World Bank. Great to have you with us.
Thank you very much, Ray. I very much look forward to our next conversation.
You've been listening to On Shifting Ground, produced in partnership with KQED, with funding from listeners like you. Today's episode was produced by Elise Manoukian, Matteo Schimpf, and Andrew Stelzer. It was mixed and mastered by Matteo Schimpf. Additional production and engineering were provided by Rob Spate. KQED's Jim Bennett is our technical supervisor. Jared Spord is our executive producer. Philip Yun is CEO of World Affairs. Our music is from Blue Dot Sessions. I'm Ray Suarez. Thanks for listening.